had about, out of 20,000 children that are born with sickle cell, between 60 and, between 6 and 9,000 babies die before they get to 5 years. And so if we are targeting reducing under 5, we must target sickle cell disease. You have had previously, we've had challenges, getting blood, for cancers. Patients with leukemia take a lot of blood. Our mothers that are delivering take a lot of blood. Our children with malaria take a lot of blood. But children with sickle cell disease are blood guzzlers. So, if we are going to ensure that we also stabilize that supply, we must reduce on the demand, and one of the demand is caused by sickle cell disease. Government has done quite a lot, and I know that people are asking, but why now? What then? Why now? So what? When we screen, so what? We are going to provide you those answers today. First of all, we integrated the sickle cell disease prevention, diagnosis, and care into our public health system. We no longer want to have verticalized, so that everywhere you go in the hospitals, we see that the children are screened at birth, but also the children that have sickle cell disease are followed up. We have also established a dedicated sickle cell clinics where we have specialists to deal with those difficult. You've heard that we get these sickle cell children come with many complications. Even some of them come with organ failure. So we need the highly specialized care where these children need to go and treated. The government has done dissemination of the clinical guidelines and training of our health workers all over the country to make sure that they all know how to take care of the sickle cell children. Now we are introducing the newborn screening services. Initially we were in some of the selected facilities, but we want now to roll over. We have strengthened our sickle cell screening capacity in our laboratories, so that the laboratory testing is now more robust. Science has evolved, and before we couldn't get RDTs. And so blood had to be taken, transported to specific places. But now we have RDTs, those, like how you are testing HIV. So rapid tests now have come on board, and that has eased our care and our screening. We didn't have enough medicines before. Hydroxyurea was not easily available and was not on the list of essential medicines. We are putting hydroxyurea on essential medicines. And also, we want to make sure that it is available up to the lowest facilities, because we still have insufficient supplies because of the budgetary constraints. But we are working with partners, and for this reason I really want to thank the partners that have been supporting us over years, and we are still with you in this journey, and want to thank you, and really from the bottom of our hearts, we want to thank all the partners that have been in this space of sickle cell care. We are continuing to highlight this disease as a problem to the public, and that's why we called you here today. That's why we are here. Professor Chigul is here as the chair of the National Task Force. We want to make it really a big thing so that it stops to be just under the table disease. If we do not address sickle cell in the next 20 years, sickle cell will be the biggest burden in our country. It will be worse than HIV. It will be draining all our resources. So the earlier we lower the numbers, the better for us. Dr. Munubi has talked about the benefits of the new screening, and also Professor Chiguli here. Because when we do the early screening, we link these children to care, to early care, so that we prevent complications. By these children getting early vaccination, we give them penicillin as prophylaxis. We give them disease-modifying therapy, like hydroxyurea. We counsel the mothers so that they look out for any possible complication or anything that require urgent attention. And because of that, it reduces morbidity, but also mortality. You have heard the testimony here of Hope, the constant admissions that she should have of her children. And so those are things that we want to prevent. If these children are linked to care early, we'll be able to prevent. And also we reduce the possibility of getting complications, including organ malfunction. We have talked about premarital counseling and testing. This is the way to go. This is the future. Many countries where they had high burden of sickle cell reduced significantly the burden in the country by doing mandatory premarital counseling and testing. Egypt has drastically reduced the disease burden to less than 0.5%, when at one time they had reached up to 20%. So now everybody who is going to get married in Egypt government ensures that you are tested and you are counseled. If you go ahead, they will have the record in the system that you are counseled, you are told, and you will sort yourself. Because if you don't want, you will not come to burden the government by bringing the diseased children when you did not, when they told you don't get married. So it is a very serious issue. And so we do believe that as a country, the only sure way we are going to reduce or reverse this curve that is going up is premarital counseling and testing. Because at that level, we prevent. So for the start, we are going to scale up newborn testing. And we're going to ensure that we have test kits available to the facilities. But also we encourage the private sector as well to ensure that these test kits are available and they are able to test whoever comes to their facilities. We really need to understand the burden right now that we have by documenting all the children that have been screened, and then we are able to plan accordingly. We want also to encourage mothers, especially that we still have pockets of mothers that don't want to take their children to get vaccinated. Now this is a motivator. If you check early and you find the child has sickle cell, that child must have pneumococcal vaccine. And of course other vaccines. it is our hope and it is our aspiration to make sure that we have the test kits available, and we continue to train our workers to make sure that we do testing and we do not miss any child that has sickle cell.